So one of the key challenges for the healthcare industry is reducing errors that cause harm. As far back as 1999, the industry was alerted to the fact that there are almost 98,000 deaths in the United States as a result of medical errors every year. In addition, the CDC would say there are another 100,000 deaths related to hospital-acquired infections.
We want to be able to see a standardization of care as well as utilizing our hospital BSI committee to be able to work on new products that will help to be able to reduce these bloodstream infections. Now this may look really simple, but it really is complex because we're asking each individual care provider, which includes both physicians and nurses, to actually follow a very strict protocol. And if any pieces of that particular protocol is not done, then we could end up contributing to the morbidity and mortality of a patient through a bloodstream infection. We're also looking at it from the standpoint of increase of a patient's stay, and when we talk about increase of patient stay, we're also talking about the costs that occur because these patients are in our hospital for a longer period of time and require additional treatment.
In 2012, our goal is to reduce medication errors that reach the patient by 20%. Today, across children's, there are almost 600 medication errors per year that do reach the patient. So certainly reducing the number of errors by 20% will have a significant impact on the quality of care we provide to the kids. Certainly med reconciliation is a key part of improving the safety of our systems, and that is really how do we make sure that we have the right medication profile for each patient, that we are reconciling those meds when the patient enters our facility in terms of what meds they're taking at home, and that we're then reconciling that against what we will administer and prescribe when that patient is in the hospital. A significant number of our errors are simple mistakes, and they're the result of very complex systems where entering an incorrect weight, transposing the height and weight as it's entered into the medical record has a huge impact in terms of the ultimate dose that patient may get. So part of that is also encouraging people to report errors. The fact of the matter is, for every error that reaches the patient, there are many others that don't reach the patient. We need to understand and learn from those errors as well so that we can ultimately reduce the total risk to our patients.
Even though you may not be directly related to or work on the areas where we have central lines. Maybe you're not the clinical person actually taking care of patients. You still have a responsibility to be able to have and create a safe environment for not only our patients, our families, and our visitors, but to yourself. And what we ask you to do is to practice good hand hygiene, as well as if you're going into clinical areas where there are patients on isolation, that you actually wear the protective equipment that's needed, the personal protective equipment that's needed in order to protect you as well as the patient.
One of our key challenges in 2012 will be making sure that every single one of us is engaged around the 2012 goals. The fact of the matter is each of us can contribute to one of these goals, and most of us will have an impact on the safety goals in particular. It's important that each of you engage on these initiatives and look at how you can perform your role and specifically how you can contribute to these goals.